Well, we begin today with the latest on the coronavirus outbreak.
This morning, Canada has recorded a 10th case of COVID-19.
Shelves in pharmacies and big box stores are being emptied of basics as people prepare for a possible quarantine situation.
The first order under this declaration will be the prohibition of organized public events of over 50 people.
Libraries are to close, recreational programs, theaters, movie theaters, all effective immediately.
Queen's University made the decision this morning to suspend undergraduate classes for the coming week.
Nursing staff are having to take on not just one patient, sometimes two, sometimes three.
We're seeing all walks of life now. The ages are actually coming even to the younger generation.
The real pandemic is mental health, that people, especially the younger generation, are struggling.
I know you want the restrictions to be over, but here in Ontario, daily case rates will soon be the highest they have been since the pandemic started. We are in the worst of it.
As First Go, this will be both history-making and life-changing. Canada is beginning the biggest ever mass vaccination program in the country's history.
Finally, a moment to celebrate after an agonizing year. This woman, a personal support worker at a Toronto nursing home, is among the first Canadians to get a COVID-19 vaccine.
After falling behind other countries early on, Canada is now one of the top countries when it comes to percentage of population vaccinated with at least one dose.
Drinks and popcorn begin flowing again tomorrow for moviegoers in BC as several provinces lift more public health restrictions this week.
Friends, there is light at the end of the tunnel.
What happens after physical distancing measures are lifted? What comes after the pandemic is over and people are able to get back to whatever their normal may be?
So the question now is, will people ever go back to commuting into crowded offices?
Should there be new guidelines for people who are fully vaccinated?
Cave syndrome. Have you heard of it? It's happening a lot right now as COVID-19 restrictions ease.
Good afternoon, everyone. Welcome, which is to what I think will be an absolute treat of an event that's coming. Thank you for joining me today. I know there's folks from across Canada. I know there's an international audience here as well. So welcome all. This is going to be a really interesting, engaging dialogue on resilience and our road to recovery with multidisciplinary experts talking to all of us. So thank you. So I'm Dr. Nancy Ross. I'm the new Vice Principal Research at Queen's and a proud Queen's alumna, twice over, I might add. My own research into the social determinants of health has been something I've drawn upon when thinking about COVID risk and resilience going forward. Think about it. Within months, a new infectious disease climbed up an unenviable leaderboard to become a leading cause of death in Canada. So while the diseases of the day changed over very quickly, the determinants of health and poor outcomes remained familiar. Low income and education, inability to avoid exposure through frontline work with high demands and low control, obesity and diabetes. So resilience will require us to look harder at the social determinants of health of populations going forward. Before we begin with the formal program, I'd like to recognize that Queen's is situated on the traditional lands of the Anishinaabe and the Haudenosaunee peoples, and this is where I'm connecting from today. I'm grateful for the opportunity to build my life on this land and that my professional role enables me to work regularly with Indigenous scholars from whom I learn every day about Indigenous ways of knowing, being, and doing. So we're really excited to share this important discussion as part of the Queen's 2021 homecoming programming, as well as with members of the Queen's community who I believe are with us today, and the public who's welcome to be joining in with us today. A sincere word of welcome. Today's event is actually the fourth in a series of public discussions we've held in the last year that have brought Queen's researchers, thought leaders, and members of our alumni community together. These events have reached, as a point of pride, over 1,500 participants who have shared questions about how we can together confront and move beyond COVID-19. We look forward to exploring more of these questions and answers today with this distinguished group. And it's now my distinct pleasure to introduce today's moderator. Elamine Abdelmahmoud is an ArtSci 11 alum. He is the co-host of CBC Politics weekly podcast Party Lines and host of the CBC podcast Pop Chat. He's a culture writer for BuzzFeed News and edits Incoming, the daily morning newsletter. Elamine's work has appeared in the pages of the Globe and Mail, Maclean's, and Rolling Stone. His memoir, Son of Elsewhere, will arrive spring 2022 from McClellan and Stewart. So please join me in welcoming Elamine back to Queens, and take it away, Elamine.
Thank you so much, Nancy. Thank you for that generous introduction. I appreciate being here. I'm excited for this event. I have to say, I was watching that video, that initial video that we, that was put together as a package ahead of this event. And I was remembering what it felt like in my body, watching some of those news stories, right? Some of those news stories from the spring of 2020, when we didn't know anything, when we were still washing our groceries, when, there was just so little known about this virus. And it's fitting that the theme that we're talking about today is resilience, because I think we've all had to sort of practice our own resilience that maybe we didn't necessarily know we had. And it's taken us here. It's taken us to this moment where we've survived, not only survived sort of the isolation, the initial isolation of that lockdown, but all that has come with it, all the upheaval that has come over the last year and a half. And so I'm excited to talk about what happens next. I'm also excited about some of the wrenches we've hit along the way. The last time that we did this event was in the spring of this year, where we talked about what might be next for COVID-19. And very few people were talking about, the phrase, the Delta variant didn't mean anything to us back in the spring. Now it's a thing that is very much on top of mind for a lot of people. We didn't know what schools might look like. Now we have a bit of practice in terms of, understanding what's going on with schools. And so I'm really excited to talk about some of the themes of where we go from here, from this moment, with some folks who know better than I, because they have spent their lives investigating some of these questions, at least from a political perspective, from a social perspective, from a health perspective, and they're going to give us their insights. So without further ado, let's start introducing our panelists. Our panelists begin with Dr. Christopher Cotton.
Hi, everyone. I'm delighted to be here in large part because I've spent a lot of the last 2 years thinking deeply about COVID and the policy impacts and the impacts on the economy and so on. At Queens, I wear several hats. I'm the Jaroslavsky Deutsch Chair of Economic and Financial Policy. I'm the Director of the John Deutsch Institute for the Study of Economic Policy. And I'm a professor in the Department of Economics with appointments in the schools of medicine and public policy as well. I've been thinking about how to model COVID for the last couple years, but more importantly than that, I've been thinking about how to weigh the economic cost of COVID with the health cost, with the cost on small businesses, on education, on inequality, and so on. And a lot of the insights that I'll be able to offer today, or a lot of the ideas that I have really come out of collaborative relationships with a lot of other people at Queens and the Department of Economics, at Limestone Analytics, the Royal Society of Canada, Global Canada Strategic Choices Group, and Canada's One Society Network. So hopefully I can do my colleagues justice and the ideas I share.
So just the very small questions of COVID. Hey, just what's going to happen to this society economically? Very tiny little question.
Yeah, just a little question. It's going to get better.
Okay.
Going forward.
I'm relieved to hear this. I'm excited to hear more. Up next, we got Dr. Elizabeth Goodyear Grant.
Hi there. Hi, I'm a professor in the Department of Political Studies here at Queens. I'm also the director of the Canadian Opinion Research Archive. My work focuses on elections, political behavior, gender and representation, as well as representation broadly for all segments of society. During COVID, I spent a lot of time homeschooling my kid and caring for my toddler. But I also managed to do some work with colleagues across the country, as well as a Royal Society working group on things like, political institutions and how they responded to COVID. The types of changes we could see going forward to put us in a better position to respond rapidly and effectively next time there's a crisis, and other things like that. We also did a lot of work collecting survey data on how Canadians were feeling about political institutions, how they were managing things during COVID, and so on. So I'm happy to be invited to participate and look forward to the discussion.
I have to say, Dr. Goodyear Grant, that the idea of parenting through this pandemic is something that I think we haven't spent nearly enough time just unpacking and talking about. Again, it's one of those memories that come flooding back that I don't actually know how we survived the very first few months of this pandemic. My daughter was just shy of 3 when the lockdown started. And we were among the lucky people, because for us here in this household, she went back to daycare in July. So it was only about 4 months or so of trying to parent while also trying to work. A lot of folks have had to endure a much longer period of that. And obviously there's going to be some long-term effects from that long period. And we're definitely going to get into those today. Up next, let me introduce Mr. Rico Garcia.
All right. Hi, everyone. Nice to see you all. And Elamine, great to overlap again. I know we overlapped as students a little bit, and fond memories of being at AMS Assembly or ASUS Assembly. My name is Rico Garcia, and I'm the president of the Queen's University Alumni Association. It's a volunteer position, and so I'm very excited to be hosting Homecoming with Sheila Rogers this weekend. And during my regular day-to-day job, I'm an engagement manager with McKinsey & Company. I studied economics at Queen's and development studies, and the majority of my work now is focused on economic development and public finance. Since COVID started, I've been dealing with several of the topics helping our clients, mainly governments, provincial, state, federal, navigate the crisis, and thinking more around economic reimagination these days. So where do we go from here? How do we build a sustainable sector strategy for the future? What were the populations, like the vulnerable groups that were most hit because they worked in a specific sector, and what kind of stimulus packages were most applicable to them, and how do we then support folks in getting back to work, reskilling, thinking about the future moving forward? So happy to be plugging in where I can amongst such great panelists here.
I'm excited to talk about that too, because, I think one of the big revelations of COVID has been that some sectors of society are way more fragile than we knew they were. I mean, I think we knew that there was a lot of vulnerability, but I don't think anybody expected it to be this easy for so much collapse to happen and then having to sort of endure this larger rebuild project. But last but not least, let me introduce Dr. Gerald Evans.
Hi there, I'm Gerald Evans. I'm an infectious disease physician and the chair of the Division of Infectious Diseases in the Department of Medicine here at Queen's University, and also the medical director of infection prevention and control at our chief teaching hospital, which is Kingston Health Sciences Center. I would have to say my challenge has been very different from many other people's. I would say my work has dramatically increased rather than decreased, and I've certainly not, unfortunately, missed a day of work since this all started, being at the coalface and not only working on things like the COVID-19 Science Advisory Table here in Ontario, as well as a number of working groups, including learning all kinds of things about behavioral sciences, which really is fascinating at my point in my career, but also seeing patients and managing patients with COVID-19. So it has been an unfortunately exciting time to be an infectious disease doctor. So I'm hoping to make some contributions, and really happy to join this great panel.
I was going to say, Dr. Evans, that the last time we spoke, because you were on this panel when we did the event in the spring, one of the things that we mentioned was I told you that I, as a journalist, have always kind of fantasized about the idea of living through history, and now I never again want to live through history. Like, I'm kind of done. I've had about enough history as I could stand. I want to ask you about how things have changed from the spring, because When we talked last, we were talking about the vaccine rollout. We were talking about the idea of how governments can maybe handle this very efficiently, but also how might people respond and how might that have an effect. But since then, we've had to introduce new words to our lexicon, words like the Delta variant. So where are we now?
Sure. Let me give you a little capsule of kind of where we're sitting at the moment, because I think that's really what we want to sort of start to drive our conversation. So one of the things that's happened is that we've understood that maintenance of public health measures while we work to achieve these very high vaccination rates have been the key successful measure in controlling the outcome of the fourth wave here in Canada. And it's differed between provinces. In provinces that maintain measures against the fourth wave, we're seeing a very muted fourth wave, one that really hasn't risen to the extremes we saw in the second and third waves. Those that had reduced public health measures, unfortunately, have suffered more substantially as a result of that, and also sometimes coupled with the fact that vaccination rates were low. So what about vaccines? Well, we know that vaccines for this disease work extraordinarily well. When we were first anticipating vaccines, we were thinking if we could get a 60% effective vaccine, we would be really happy. So here's where we're now. Here's where we are now. We know that these vaccines reduce the risk of severe outcomes, including death, by about 90%, and in some cases even higher. We know that they also reduce the risk of actually getting infected, probably about 70 to 75%, and that's been somewhat tempered by Delta. And we also know that they can reduce the risk of transmission if you do become infected and you're fully vaccinated by about 60 to 70%. So this is literally nirvana when it comes to vaccines. These are incredibly useful vaccines. The Delta variant, as you've already pointed out, really has done a real number on us. And as a musician, I always think about the Delta blues and think this might be a new way to describe them. But the one thing about Delta is it's outcompeted all the other variants. And what's fascinating is to see how globally now Delta just dominates the entire COVID-19 panorama. All of the other variants, some of which we're worried about, Alpha, Beta, and Gamma, and even ones with that are just variants of interest like Epsilon, Mu, and Lambda, they just really can't compete with Delta. But what's really cool is that Delta, despite its transmissibility problem and probably some issues related to a slight increase in severity, it hasn't been able to evade the immunity that were induced by the vaccines. So that's really been a little bit of the story of what we've seen now into the summer of 2021. But what I would emphasize is we need to continue efforts to vaccinate globally. And they're vital in order for us to get into our post-pandemic world. And our post-pandemic world is going to look a little different from what we saw before the pandemic, but I'm going to leave the other panelists to talk about what that is going to look like. But these efforts have to be at the forefront. And you know, we're at a point now where we're talking about third shots and boosters, but we need to get everybody around the planet vaccinated because that's going to reduce the emergence of variants, which could pose some more danger to us. So that's kind of where we're sitting right now at this point.
You know, I have to say, Dr. Goodyear, Grant, that when I hear that, I start to think, maybe what I was waiting for is a parade. Like I was waiting for some kind of parade that says COVID is over. And now we can begin thinking about all the questions that come after that. The questions that are, okay, how do we sort of like get the economy back into a gear that is a pre-pandemic gear? How do we sort of realign the, you know, what politicians are promising as like something that is like not just about COVID, but about the other things, the other parts of politicians' job, because they maybe not doing those jobs as effectively because they're so focused on the pandemic. And I guess what I'm gathering here is that this parade is not going to come. It's going to be sort of like a slow sort of shift away from COVID, and then we start to add other priorities. So how are we feeling now about the ways that government is relating to people in terms of tending to their other needs that are not COVID?
Right. So, wow, we just had a federal election and a renewed mandate for the Trudeau government. Mm-hmm. This government is wasting no time in getting on with the business of governing and getting back to work. Maybe straddling both the pandemic and the future. I mean, one of the big items that's coming through right now, and which is like, you know, 50 years coming and a massive legacy project for the Trudeau government is universal childcare. Yeah. This government announced in its April 2021 budget a $27 billion commitment to providing universal childcare in the country, and has negotiated agreements with 7 provinces and 1 territory, and is in talks with Ontario, Canada's most populous province. So, I mean, I think if we think about the way that we're rebuilding or building back better during we're not post-COVID, but like maybe the light is there at the end of the tunnel. I think that this federal government is definitely trying to take some lessons from the pandemic to create infrastructure. And of course, childcare is infrastructure that will help us weather future crises. And that will also put us in good stead for normal times too.
Dr. Cotton, what about you? How do you see us sort of reorienting ourselves to the post-COVID world?
That's always a problem, and even on a panel where you don't unmute yourself. So I think that there's going to be shifts in terms of the technology. Any kind of crisis, any kind of disruption spurs innovation, right? It spurs innovation not just in terms of the products and technology, but in terms of the way that we work and live. But also it highlights failures that we've had going through the crisis, and childcare, the ability to continue working while schools are disrupted. These needs are certainly very important. I think that we're also going to see shifts in just the way that people are working, and maybe decreasing some of the geographic constraints to the types of jobs or education that people pursue. And I think that we are going to see big changes in kind of where we settle post-crisis that are going to be very different than where we started things ahead of the crisis.
Now, Rico, one of the ways they explained your job right now is you explained it in the context of reimagining. And maybe reimagining is about planting some seeds and seeing what grows, seeing sort of what directions are going to take. At this point, can you tell us about what is sprouting? Like, how do you if it's working, if we are getting out of this crisis, what are the signs that you're looking for in terms of seeing us getting out of it?
Yeah, I think it's a great question. And I think to me, it's all about thinking about how do we build a better society, a better economy, a more inclusive one moving forward, and don't just focus on recovering what may have been lost or the status quo that we had before COVID, right? So the way that we think about it at work is, and apologies for the use of frameworks, but as consultants, that's how we think. But I think about it in 5 ways, right? So when it comes to people, business, sectors, regions, and then government. So when it comes to people, as Dr. Cotton was mentioning, is how are people's preferences changing, both as a consumer, in terms of working from home, flexible jobs, how is the consumer people changing fundamentally? Businesses, how are they rethinking their supply chains? Are they thinking about nearshoring? Are they thinking about their talent differently, right? What are the skill sets of the future, the technology adoption? When it comes to sectors, what are the sectors that we got to pick as those new growth sectors? So we're making a play on biosciences, life sciences, right? As opposed to other sectors that may be sectors of the past. And so how do we think about a sustainable future? When it comes to regions, you're seeing the politics and the geographies like much more concentrated than before, less globalized. So how is that going to play out? And then finally, how is government providing those new services that are much needed? I think Canada, we have a good societal, social safety net. I think in the case of the US, there's a lot more conversations, but like Dr. Goodyear Grant mentioned, universal childcare and other needs are starting to emerge as well as things that government is playing into.
I guess, Dr. Evans, when we think about these ideas, does it feel like we're sort of putting the horse before the cart here, or are we sort of getting too far ahead of ourselves in terms of thinking about post-COVID? Because there's still this reality of governments all around the world are really eager to begin that reopening process, right? To begin removing as many mandates as possible. And there is obviously reception to that, but I'm not sure how the medical community is looking at that eagerness and treating it right now.
Yeah, you're absolutely right. What I've oftentimes talked about is how we're really in a transitional period. We're going from the pandemic period into what is going to be a post-pandemic period. And as you said, and I think it's been commented already on by some of the other panelists, this is a gradual process. This is not going to happen overnight. It's not going to be the parade, Elamine, that you were sort of mentioning. I'd love to have one of those myself too. But essentially, I would say some of it is being driven from the healthcare sector. And as many people know, there has been an incredible focus on the healthcare sector and the impacts that this has had. And essentially, those in us who are in healthcare are very hopeful that we are at the beginning of seeing this reduction on the strain that's been placed on healthcare resources in general. At the same time, I would say we're a little trepidatious about society itself returning quickly to some sort of pre-pandemic mindset. I think the idea of going back to the way things were is just not a premise that I would start on. And, you know, I think one of the things that the pandemic has taught us, and as a guy who's done pandemic planning for years, we were always thinking, by the way, about influenza, and I always said it was going to be a left field virus, like a coronavirus that hit us, is we're still getting thrown a few curveballs by this virus. And that could still go on to challenge our capacity to provide care for all persons. And I think it's important to really understand, and I think all of us do, and certainly this panel being where they're composed of, has to recognize while we've been taking care of the pandemic, there's all kinds of other healthcare that's been sacrificed. And sacrificed, I mean, at least delayed. And we have to find a way to get back to catching up. That's going to take months, if not years, to do, and that kind of delay in COVID care is teaching us a lot about, you know, where things need to head in the healthcare systems. That's where I work, just simply because I don't think it's sustainable to continue to run healthcare at 100% capacity when there isn't a pandemic. Because when things like a pandemic hit, they teach you very quickly that that is not a good strategy. You have to have an ability to handle surges.
Now, picking up on that thread of the idea of going back to the way that things were, whether that's possible or not, Dr. Goodyear Grant, I think we've talked about how maybe the pandemic has revealed the depth of some existing inequalities, right? Like we sort of knew that they were there, but we didn't know how much worse it could get kind of quickly, like basically overnight. But another thread that's kind of interesting that the pandemic has revealed is actually like just how fast governments can move, right? Like we never would have, you just never would have expected a program like the SIR program to be rolled out in a matter of weeks. It's like you would imagine that, you know, as a thing that would be studied and studied for years and years in terms of like what its impacts were. But no, the governments didn't really have a chance to, you know, focus group this to death. Instead, they had to just roll it out and worry about the consequences later. For us politically, I have to imagine that our relationship to government changes because of that. Because now we see, okay, now we know that there are problems and we can identify those problems. But we can also identify that if the government really wanted to, they could just like overnight just pitch a tent and make the thing happen. And I wonder how that changes our relationship to our expectations of what a government can do.
Yeah, I mean, those are good. That's a lot to unpack. But
yes, that's true.
Just a couple points then that I would sort of like say in response. This experience has definitely highlighted that political will is king.
Mm-hmm.
Government has massive capacity and a lot of resources to do what it wants to do,
yes,
or to do things when it needs to. And that was, I mean, not only CERB and the supports for business that were rolled out within like literally a couple of weeks, but like look at Canada's vaccine procurement when we have no domestic production. Like that was astounding. I mean, despite, you know, some grumbling initially that it wasn't happening fast enough, we became a global leader in, you know, vaccination of its population. So I think during the pandemic, public confidence in the capacity of government definitely did bump up. That's sort of eroded again now that we're sort of moving into more normal times. But people did see and acknowledge the action that government took. And this maybe does sort of raise the bar a bit on the expectations moving forward. And it should definitely raise the bar, especially for marginalized communities. Because, you know, for so long, governments have said, well, yeah, we're going to tackle all the boil water advisories in Northern and Indigenous communities, or yeah, we're going to deal with, reconciliation or, racism in cities or whatever the question may be. But we know that governments can do all of these things. The question is, will they choose to, right? And so just to sort of play off what you're saying there, I think it's demonstrated the power and capacity of government. And now the responsibility is on government to deliver.
Right. And I guess I'm interested also in maybe the consequences of that if they don't deliver, Dr. Cotton, because, one of the things that we've learned through this pandemic. So, for example, I remember, I think it was June of 2020, that Stephanie Kelton's book, The Deficit Myth, came out. And honestly, I feel like any other year, that book saying, like, we don't actually have to worry that much about government deficits would have kind of been, let's say, how do we put this nicely? Kind of like exiled to sort of like the outside of economic discourse. But it kind of landed in a moment where maybe our expectations of economic policy were shattered all of a sudden, because we learned that we can move really fast. And maybe some of the rules that are governing our society in terms of what we thought about conventional economics don't necessarily apply. So I'm just wondering, but your take about what are our expectations of how the economy should behave and our relationship to those big ideas like deficit and debt that are so central to so much economic thinking, but there's been arguments that say, should they really be that central?
Yeah, that's an excellent question, and one that I think we're all struggling with a bit. The truth is that there's a lot that we don't understand about the economy and the way that different pieces of the economy interact and will respond to different things. It's a very complex system, and knowing whether or not we can, some of the rules are more flexible than we thought. Knowing how populations as a whole will react to a policy that some simple theory that we learned in intro economics says shouldn't happen. We learn all the time that we have a little more flexibility than we think that we do. There's still the trade-off, though, even in the material that she's thinking about in terms of worries about inflation. Worries about prices spiraling out of control when the government keeps spending and spending and spending, so they can pick up slack, but they can't necessarily have a blank checkbook, right? They can pick up slack when the economy has slack, but they can't just keep spending. So I think that it's a matter of finding the right balance there and to rethink really what the priorities are that we want to keep spending on, and which are the things that we might want to introduce in times of crisis, in times of unemployment, in times of other things. Though we do have, but even now there's lots of questions just about how much slack is there. There's a lot of unemployment, but there's also a lot of firms looking for workers and finding the right balance with work and what people want out of their careers. These things might all be changing on us in ways that we're not used to.
Rico, I have to imagine from your perspective, that's exciting because there's a lot of sort of unknown possibilities here. And so when we think about those really hard hit economic sectors, when we think about tourism, when we think about travel, when we think about restaurants, maybe suddenly the opportunity to give support to those sectors becomes wider because we maybe understand that governments can do more and there's more appetite for people to sort of dole out that support. So what kind of stimulus needs do we need for those sectors?
Yeah, I think it's a great question because the stimulus need changes from the very beginning of the pandemic to where you are today, right? At the very beginning of the pandemic, like Dr. Goodyear mentioned, it was all about getting cash out the door, right? You saw the example of the US of saying, like, we're not even going to try to figure out who needs the money. Let's just give everyone the money. In the case of Canada, it's like allow people to just like self-enroll. And you even went to the website and the government would tell you, like, please do not do this twice. Because like there could be like glitches in the system. You could get your money twice. Obviously, they'll come back and take that money afterwards. But it was all about getting the assistance quickly, right? So when we did the analysis, specifically in tourism, there's a lot of small businesses. And when you think about small businesses, the average cash on hand that we analyzed was about 27 days. So that means that if you're closed down for 27 days, you're going to run out of cash. You won't be able to afford wages. 44% of restaurants expenses, for example, are labor on average. And so how do you then think about providing wage subsidies as the right stimulus option, as opposed to, tax forgiveness or rent pardons or something else, right? So what are understanding the balance sheet for each of these specific businesses to then say, hey, maybe an additional credit might not be as beneficial as just subsidizing these wages. And when subsidizing wages becomes important is in preventing people from losing their jobs. Because then once people have already lost their jobs, and we're seeing this today with restaurants, they're struggling to hire new service workers. Lots of restaurants have signs up on their door, and we can talk about wage income and all the other challenges there later on, but they can't attract the talent that they had before. People might start at a different job, realize they have better opportunities elsewhere. And that perhaps wouldn't have happened if you had then done a little bit more with the wage subsidies to prevent those people from then losing those jobs, right? So I think it shifts and it changes. I think moving forward, it's around, again, doing the assessment and thinking, what do these businesses need? I think our economy is going to need a lot of reskilling, right? There's obviously some pockets of the economy that are quite hot. They can't hire enough talent, and others that are struggling. And so how do we then do the right matches, and how do we focus on our people and I think train them and allow them to find an opportunity that is good for them?
First of all, let me tell y'all, I could spend an hour on this, and I'm really tempted to, but I will sort of keep it moving to the next sort of set of questions that I have, which is about the ways the pandemic has maybe fractured us, but also brought us together. Because I do think we've seen a lot of exercises in that, and maybe I'll start with you, Dr. Evans, on this, because the divisions we've seen over vaccine mandates and the divisions we've seen over vaccine hesitancy, they've been, I'm genuinely so worried about them that I'm just like not sure what we're going to look like after we come back together. After this thing is over, to whatever extent it can be over, the ways that those fault lines have kind of been set up, it really feels like acrimonious in a way that is not easily healed. And I'm just wondering if there's anything in the pandemic planning handbook that addresses that, because I'm not sure that that would have been an obstacle that anyone would anticipate. I think you'd imagine if you're setting up that handbook, you'd say, well, when the medicine comes, then like people will be maybe open and receptive and excited about it. And that is not necessarily the case everywhere.
Yeah, what's really fascinating for myself and my colleagues who study sort of the whole concept of vaccination, both from a biomedical point of view, but also understanding sort of the drivers of vaccines and vaccine hesitancy, is we've got a clearer idea now a little bit about how some of these groups, how big they are, how much of a challenge they pose to us as we've tried to roll out really what, as I started off saying, I think has been one of the real hallmarks of this pandemic is the rapid development of extraordinarily effective vaccines. Mm-hmm. When we were doing pandemic planning for influenza back in the 2000s, two knots, I guess is what they like to refer to it as, one of the things that we never talked about was social media. And that's because social media didn't really exist in a really significant form back then. There was no such thing as Twitter. There was no Instagram, no TikTok. There was Facebook, but everybody thought that was for teenagers and young people, nothing else. And it pans out that has been a huge issue. So one of the interesting things is that we now recognize in that group that has been sort of a little bit, I'll say, I'll just use the term skeptical about vaccines. There's really two groups. There's a group that we can refer to as vaccine hesitant, and they're probably about anywhere from 10 to maybe 12% of the population, because about 80% of the population's firm on vaccines. You tell them you got a vaccine, they're out there rolling up their sleeves, give me the vaccine, I know this is going to help. So the vaccine hesitant folks, we have actually developed some pretty darn good strategies. There are lots of education, lots of patience. Literally, I can spend a great deal of my day individually talking to vaccine hesitant people, obviously mostly in the healthcare sector, because here at the hospital, we want to have 100% vaccination rates. We're pretty darn close, by the way, in most hospitals. But that's a fairly intensive effort, but it works. If you talk to people, give them the chance to sort of express their fears, their concerns, their worries, and maybe knowledge gaps, you can actually get them vaccinated. But what we've also discovered is that there's a firm group, probably somewhere between 8 and 10%, that are fervently against vaccination. And they line up, unfortunately, quite well with groups that are also sort of science contradictory or anti-science, if you want to call it that. And they're oftentimes driven by ideological and political feelings, and those have been greatly, greatly amplified through social media. In the old days, if you thought that radio waves were coming into your house and you put up aluminum foil, well, the only way to talk to other guys who felt the same way was you had to kind of write them or see if their windows were covered in foil. Now you just go on to Twitter or Facebook and you can find whole groups, the tinfoil group or whatever. So that's been, I think, the incredible challenge. And I think, and it'd be a great point to discuss, is how political and ideological movements have been centered around some of these concepts. So they've embraced them in order to bring people into the fold. And what's interesting to me is that if you look at these groups, they're often very heterogeneous. They you may all kind of be anti-vax, but some of them believe in this and some of them believe in that, but that's what sort of brings them together. And I think that's the real challenge. And I think this pandemic has really revealed to us where those fault lines are, where we have to start looking at our future planning endeavors to make sure that we can do that. Because I will tell you now, if we could get 100% of the population vaccinated, we'd be over this pretty darn quickly.
I mean, this is where I was going to go next to Dr. Goodyear Grant, because not only is the politics a crucial part of this, but it's also like it was a central part of this election that we just had, the election campaign that we just had. And politicians of all stripes were very happy to sort of exploit those differences along those vaccine lines, which again, maybe was beneficial in terms of winning votes. I'm not really sure it was beneficial in terms of sowing a national identity in a moment of crisis. And so I'm wondering about your thoughts about using vaccine mandates as a political tool, as much as they are also a public health tool.
Yeah, I mean, this is exactly where my mind was going when Dr. Evans was speaking. I mean, the sort of picking up of the anti-vaccine, anti-lockdown, masking, all of these people. I mean, this has been used opportunistically by alt-right movements and parties who, in some cases, may or may not actually have genuine or sincere beliefs about this, to stir up cultural resentment, economic grievance, and other things. We saw it in the US too. It's more widespread and stronger and has had dire consequences in some cases, but it's happening here too. And we started to see actual violence in terms of protests during our federal election. And then we're seeing it sort of carry over to now with these hospital protests, which is just, you can't imagine it even happening. So, the rise of the People's Party, not the rise, I mean, that's a very dramatic overstatement of what happened to this party that won no seats, but the surge in the polls of People's Party compared to the previous federal election was driven 100% by anti-vax opportunism. And so combating that is extremely difficult, right? Because we're talking about disinformation in a very chaotic and largely unregulated information environment targeted towards vulnerable people.
I think that's exactly right. But it's a matter of, what I'm curious about then is how do you begin to heal those divisions afterwards? Because, I can listen all day to arguments about how the People's Party used those, to a certain extent, how the Conservative Party used those arguments about vaccine mandates. But also, on the other side of that, liberals were very happy to sort of exploit the difference and say, we are interested in this vote, and those people might not really believe in the science that you believe in. And I guess what I'm trying to say is, does that threaten our national unity in the face of all of this? Because it feels like it might.
Yeah, I mean, for sure. I mean, that's the funny thing about elections too, right? Elections are these moments where contestants emphasize their differences and then afterwards expect different regions or different political groups to sort of come back together and then focus on the business of governing the country. So elections are by their nature divisive. And highlighting ideological and policy differences. I mean, one of the funny things during this election campaign is that if we focus on the sort of two main competitors, the liberals and the conservatives, they did go to great pains to try and differentiate themselves, but their actual policies were not that different.
No,
right?
they really weren't.
Not
Yes.
at all. So, O'Toole was promising everything except an actual mandate. But if you require like daily testing of your employees, that's tantamount to requiring them to get vaccinated, because they're going to get vaccinated, most of them, especially the hesitant, if we're going to separate them from the opposed, rather than go through this daily testing. So they sort of came in many ways to the same position, but without, like not exactly the same policies. So it's always funny during elections, like the highlighting of these like very small differences and then, making such a big deal about them.
I again, want to spend so much time on this specifically. And I wish that I could, but I'm going to get to some of the audience questions that we're getting. And so let me just pull one up. This question is for Dr. Kelton, and the question is, how do we expect the rocky recovery of the United States due to their flare-ups of COVID, but also like these supply chain problems that we're seeing, labor shortages? How do you think these will affect recovery and reopening in Canada?
So that's a great question. Before I answer that, I'm going to actually derail it a little bit and just build on that last point by Elizabeth and Gerald a little bit, because even though we're seeing a lot of tension maybe within politics and within the population, I think that over the course of the pandemic, we've seen a lot of alignment between researchers in this space, or between epidemiologists and economists, that just didn't exist before. Because in the beginning, there was a lot of tension between, a 2-week lockdown, this is horrible for the economy, this is good for health. We're like butting heads around this. But then over the course of the pandemic, we've realized a lot of things. And that's that basically we're much more aligned, and we're going towards the same objectives than we ever imagined before. So the more we were able to start working together to address these problems, the more we started working on models that could look at both long-term economic outcomes and long-term health outcomes, the more we realized we were actually speaking the same language. We're actually really aligned in terms of the types of policies that were good or bad. So anything that we could do in terms of increasing vaccination rates, in terms of severe lockdowns, strict lockdowns for a shorter period of time that can get us rolling again without the need for future lockdowns, anything along these lines is actually really, really good, both for health and for the economy and for education and for inequality and all of these other things. And so I think that even if it's been politicized, there's a lot more overlap between the professionals working in different spaces and so on, in terms of really working towards the same thing compared to where we started. In terms of the supply chain and how that may affect us, obviously this is going to add a lot of uncertainty to the recovery. It's likely going to delay the recovery longer. We have projections showing that if our supply chains are slow to recover, this is going to just delay things. It's going to make things last a lot longer into the spring. I'm not sure that it changes where we're going to end up in the long run. Although we may be very tempted to start investing in strengthening our own internal production in some areas and so on, where there's actually kinks in the supply chain that's slowing down and hurting businesses. Rico may have other things to add regarding this.
Yeah, thank you, Dr. Cotton. I think on my side, a lot of what businesses and countries are thinking about is precisely capturing on the opportunity as well that presents itself for nearshoring, right? So you talk to Central American countries and they're thinking, how do we then attract some of the supply chains that are currently for the US relying in Asia and bring them out here? So how can we think about Canada perhaps positioning itself favorably? You think about an industry like the automotive industry. If we think about reimagination, we think, I mean, it's no longer a reimagination because it's a reality, but you think about electric vehicles. What is missing to be able to be a powerhouse in producing electric vehicles in Canada so that we then have that cluster here as opposed to in Detroit? And so we can think about that more localized supply chain to not only favor Canada, but also the region. I think it's going to be a crucial part of the resiliency. And you think about sectors. When you think about the previous wars, like like World War I, World War II, a lot of the national economic strategies came out of those those wars built infrastructure, you got Airbus, Boeing, they were deemed national security interests. And so to what extent are some new industries, sectors like biosciences are now national security interests as well, and therefore we need to start building those as well at home.
I think there's a real thread of everything we used to know about our areas of expertise is kind of in flux right now. And so what are the opportunities that present themselves when everything is in flux? And there's a really interesting tension in this moment between people who want to use that maybe uncertainty to create those future opportunities, and people who are saying, let's get back to what we know, because that is a safe place to be. I think that's a fascinating tension that's going to play out, not over the next month or 6 months, but over the next few years. Dr. Evans, this question is for you, and it's no pressure, but it's how can we ensure we're better prepared for future public health crises like these? Did we do a good job applying what we learned from SARS, and what were the opportunities policy-wise?
Oh, that's a great question. And actually, frankly, I've been asked that not infrequently. SARS was in 2003. And boy, oh boy, did that result in some major fundamental changes. Lots of investment in public health, the development of arm's length agencies at federal level, at the provincial level, et cetera, to really handle things. But what it shows is that limited memory that I think society has. Because just before the pandemic hit, there were actually lots of discussions about curtailing the monetary investments into public health and to sort of start downsizing it because, heck, nothing's happened for the last 16 years. Why are we doing this? Maybe we should be putting it into hospitals where guys like Gerald Evans works, because I take care of sick people and make them better kind of idea. And boy, oh boy, was that ever wrong thinking. I mean, that was just sort of showed it. And of course, even that initial minor weakening of public health really opened up what we saw are a lot of big problems. And I can't reinforce enough that one of the problems with public health is that when it's working well, when it's invested into and functioning, nothing happens. That's how public health works. Right. Nothing bad happens. Babies are born healthy. People stop smoking and we see a drop in all kinds of health issues related to those things. We fix problems related to substance use disorders that help to increase the health of people and destigmatize things which are otherwise out there. And then pandemics don't happen or outbreaks are reduced and they disappear. So the problem when you're investing money, I think, and I'd look at Chris. By the way, Chris gave a great lecture that I actually used some of his slides, which I stole in my talk. But it's okay, Chris, I attributed them to you because it's really fundamentally understanding that sort of interaction that kind of helps us really, I think, move forward on this. And the public health, I think, again, public health can't be pulled away from health in general. When public health declines, what happens? The healthcare system, the acute system that I work in, gets overwhelmed during a pandemic or other problems. So I think that's where there's a fundamental mindset reset that needs to happen so that governments and the population in general understand that. I think people have realized, like, holy mackerel, when a pandemic hits, everything collapses. I can't get my routine x-ray done. I can't get my little health problem disappear because everybody's sick with an illness that could otherwise be controlled and prevented.
Mm-hmm. Now next question is for Dr. Goodyear Grant, and the question is, how has the pandemic changed trust in government, in your view?
Trust in government. I spoke to this a tiny bit a little while ago. Trust in first of all, I have to say, in survey research around trust in government, we're not always sure what people have in mind when they answer. So does that mean trust in the ethics of government, trust in or confidence in government capacity? Does it mean, some people will interpret it as a sort of referendum on the government of the day. So right. I would preface it with that. And trust in government has been declining for decades. But during the pandemic, especially in the first few months where government did step in and actually did some truly heroic things, if we're thinking about, as we were talking about earlier, public confidence, I would say, in government increased dramatically. According to some time series, by 10 or 15 percentage points.
Oh, wow.
Which is wild. That has gone back down to sort of like normal levels since then. But I mean, I think one of the interesting things about that is that it shows that the public is paying attention and reacts appropriately when government delivers. So that's always a good thing. If we think about the relationship between government and the public as one involving a feedback loop, right? And trust in, I'm thinking about like Dr. Evans and his work, trust in medical experts and scientists generally surged. So I don't want us or anyone else to like propagate a sort of narrow idea of what, to sort of, I don't want us to exaggerate the extent of anti-science, anti-vaccine, anti-lockdown restrictions, right? The problem with the very small minority that actually believes this or is, pushing this forward is that they're extremely vocal and extremely effective at communicating. So the public definitely responded to, the scientists, the medical experts, and so on, and that puts us in good stead for the future.
That's so reassuring. I am relieved to hear this. Thank you. Okay, so this will be the last audience question that we take. And it's to Dr. Kelton. It's sort of a play off this earlier idea that Dr. Evans talked about in terms of getting the rest of the world vaccinated, because that will make us safer. But the question here is, considering worldwide vaccination will impact our future, to what extent do you think economic recovery, not just in Canada, but abroad, will end up being a driving force in economic recovery here?
Oh, absolutely, 100%. There's no question that our economy, Canada in particular, right, is an economy that's interconnected globally, and it depends on all of this. And as Rico was talking about, other countries in the Americas maybe stepping in to help with the supply chains and to take opportunities to engage with us on things that maybe they haven't before. I mean, everything's connected. And I don't think that there's any way to get away from this. This would suggest that we do have to prioritize getting vaccination, getting recovery, not just in Canada, but abroad as well. We may have been one of the quicker countries to get high levels of vaccination, but our economic recovery will be limited and slowed by slower recovery elsewhere as well.
Now, let me close out the event here by just asking each one of you guys this last question. Rico, I'm going to start with you. And the question is, in your experience, has the pandemic revealed our resiliency in any kind of way? Or in what ways has the pandemic revealed our resiliency to you?
I think in the ability to adapt, right? And I think and innovate. We think about working from home, and you mentioned it, being a parent, and for the first 2 weeks of the pandemic, figuring that out, and businesses, government adapting, right? You think about telehealth and the adoption of that, and then maybe the relaxing of some of the rules to allow us to continue to move forward. I think that's all very important. I think we're all capable of adapting. We're all, I think, capable of uniting towards a common goal. And as we think about moving forward, is how do we then build a better society? I think about, we're addressing right now the pandemic. How do we address other big issues like the climate crisis moving forward? There needs to be like a will, and we need to adapt, right? So I'll leave it with that specific thought because I know we're short of time. Thank you.
Dr. Evans?
Yeah, my big comment is I think that it's shown us a lot of resiliency, particularly in the healthcare system where I can make most of my comments, but it's been very severely tested. And I think to some degree, the public, I think now sees the problems of a healthcare system, and Canada's healthcare system is to be envied around the world. But when you run it at 100% capacity, you cannot deal with surges that are created by natural phenomena like pandemics. And it's not just the physical infrastructure, it's the human resource infrastructure. I think everybody's been taken aback, and I've personally experienced it with colleagues and even myself, that this has really stressed us. And we are used to it. I went in being a doctor because I like taking care of people. But when you push and push and push that eventual care motivation really get stressed. And I think we need to really re-examine that. We've now seen wholesale departures of people, early retirements, people just leaving healthcare in general, nurses, doctors, physios, respiratory therapists, everybody. And so given that this is one of the crown jewels of the Canadian society in general, I think we really need to pay some attention to that. We need to have the resiliency there. It's been there, but it's been severely tested.
What about you, Dr. Cotton, from where you're standing? Has the pandemic revealed our resiliency in a kind of way?
I think it has, but I want to take a different approach to answering this, because even though it has revealed that certain sectors of the population, certain areas of the population, certain types of people have been very resilient to the crisis, it's also revealed a lot of vulnerabilities amongst more marginalized populations, amongst younger workers, amongst women, working mothers, again, school children, against the poorer populations. And I think we have to be careful thinking, oh, we're resilient as a society just because the economy is starting to bounce back and the healthcare system is starting to recover, because I think we've done damage. The pandemic has done damage, and the lockdowns and so on have done damage to these marginalized groups, marginalized communities, that it's just going to take a lot more effort and initiative to overcome. And if we don't focus on them, if we don't try to address these issues, they're going to be persistent for a long time.
Dr. Goodyear Grant, take us home.
I'm just going to build exactly on what Clark has said here. I actually don't like, I like the term resilience as applied to institutions. So we can talk about the extent to which institutions have built in flexibility and capacity to deal with unforeseen events. So great. And we've talked about that. I hate the word resilience applied to people and groups because it risks overlooking the fact that many segments of society did not have the resources to grit their way through this pandemic. And it also individualizes or puts on individuals responsibility for making their way through, when in fact we know that it's structures and institutions that have responsibility for helping a population through this. What else is government for, if not to help us through crises? So in terms of a replacement, maybe we can focus on hope or, the ability to rethink a better way moving forward. But yeah.
Well, I think that's a good place to leave it. I would be so curious to do this again in a year and see where we go, because as we touched on in all of this, there are a lot of things we just don't know. We don't know how those things are going to play out just yet. So I'd like to thank all of you, Dr. Cotton, Rico, Dr. Evans, Dr. Goodyear Grant. It's been a pleasure. I'm really looking forward to continuing this conversation. Thank you so much. All right, and just so you all know, this conversation will be available to you. I think it will be available through the social media channels of the Advancement and Research channels, I believe, from Queen's. And thank you so much for all of you for attending. Thank you, Ashley, for being our ASL interpreter. This has been a pleasure to have, so thank you so much for your time. Appreciate it.